Hello everyone, I am Jaya Bahaduri from Search India. Today, we have again the honor of speaking with Dr. Aditya Gupta, the Chief Neurosurgeon at Artemis Hospital.
I am Dr. Aditya Gupta. I am the Chief Neurosurgeon at Artemis Hospital in Gurgaon, and I also look after the CyberKnife program.
So the first question is, how do you see the future of neurosurgery, particularly in the areas like minimally invasive surgery, like cyberknife, and more related to that?
I think that's an excellent question. See, neurosurgery, the way I have seen it evolve in the last 30 years that I've been into neurosurgery, I see two very distinct themes emerging. First of all, the treatment is getting very customized for the particular needs of a patient. There is no procedure which is being offered, for example, to all patients with brain tumors. Second thing which I see happening is from the routine invasive or open neurosurgery, we are coming down to minimally invasive neurosurgery, both in the brain and the spine. And now, from minimally invasive neurosurgery, we are actually coming down to non invasive neurosurgery using the CyberKnife or the Gamma knife. So, what this treatment is basically called is stereotactic radiosurgery. Very simply, what we intend to do in this treatment is to use radiation like a knife. So, what we do is that we deliver an extremely high dose of radiation, but very precisely, exactly to that point where the tumor is located. And the small or moderate sized tumors we can treat in the space of 40 minutes with just one session of very, very precisely focused high dose radiation with the CyberKnife. So, this technology is actually revolutionizing the way that we treat brain tumors. And actually, every day I get a number of patients coming to me and specifically asking for CyberKnife treatment.
So the next question is, what actually inspired you to specialize in neurosurgery, and what has been the fulfilling aspect of your career so far?
See, I think personally, when I joined medical school in 1989, maybe by the third or fourth year, I understood that my personality, what I want to do would be more like that of a surgeon, in the sense that I loved anatomy. Uh, I loved anything to do with surgery. I loved the action of surgery. I also loved the fact that in surgery, immediately you can make a huge amount of impact to somebody's life. In medicine, it is more slow, it is more indirect, it is more intellectual. Sometimes you have a difficulty in reaching the diagnosis. Sometimes you try a treatment, some treatment works, some treatment doesn't work. So for me, I think what reached out to me was that in surgery, it's a very high impact which you can give in a very short space of time to an individual patient. And surgical diseases, by and large, are those diseases in which medicines don't play a very important role. So, really, a patient heads for surgery only if there is hardly any option for a treatment possibility with medicines. Now, that having been said, what really appealed to me about neurosurgery was this is a specialty in which huge progress was being made. Newer kinds of instruments were coming out. Imaging itself was breaking new ground every few years. When I joined, at that time we had the first generation CT scanner in which each CT used to take 35-40 minutes. And even then we used to get a very grainy image. Now we have a 3 Tesla MRI which can give you wonderful images of the brain in exactly 15 minutes. So, what really attracted me and inspired me in this direction was the huge progress in technology, the huge impact we could make to save somebody's life. For example, somebody with a big bleed inside the brain, somebody with a big tumor in the brain. I think we could really make a huge impact to salvaging the life and restoring the quality of life of them.
So the third question is, could you discuss a breakthrough case or procedure that stands out in your career?
So, one of the procedures or the kind of surgery which I really like doing is what we call epilepsy surgery. So I still remember a patient. He was a 14-year-old boy. Um, he came with a history of epilepsy which was not getting controlled despite four drugs that the patient was on. He was taking four drugs in maximum doses. That was interfering with his school education, and still that was not controlling the epilepsy. Now, when we did a video EG, we did a very special quality MRI. It stood out that there was an area in the brain which we call as the hippocampus on the left side that was creating the epilepsy. And after a successful epilepsy surgery, now it has been 9 years. Immediately after the surgery, the seizures stopped. Approximately 3 years after the surgery, we started reducing the medicines. Now, the same 14-year-old who's now 23 is free from epilepsy, and for the past 3 years, he is completely free of any medicines whatsoever. So, this kind of an impact that you can have on somebody's life, wherein somebody is struggling at school, epilepsy is not getting controlled. You do this kind of surgery, and the epilepsy gets controlled. Then they are off the medicines. Then he has just finished college. He is able to get a driving license because he's not having epileptic seizures. So you can actually make a phenomenal impact on the life of a person.
Thank you, sir. We have already covered some of the general neurology insights in our previous video. Check it out via the given link in the description.